Namaste, I am Shamprita from India. I work as the Senior Program Manager in Fondazione della Vita or FADV. Till today, the number of cases of COVID 19 in India is more than 23,000. Here, the lockdown has started from 24th March and has been extended till 3rd May. Due to this nationwide overnight lockdown announcement, the mostly affected people are those who work in the informal sector labor. With more than 80% of India's workforce associated with informal sector and one-third of them working as casual laborers, the lockdown has affected these marginal communities due to the loss of livelihood, lack of food, shelter and basic amenities. With little or no savings, these people are left with fewer meals and have started borrowing money. They are braving the threat of police violence and are going out for work. Not only this, they are also taking their children with them to earn something extra. In West Bengal and Assam, where FADB works, there has been a barter system started by the people where they are exchanging utensils, clothes, and phones for food. Since food crisis is so high among these marginalized families, the basic items like masks and soaps needed to prevent COVID-19 is of least importance for these families. Regarding government's initiative to fight COVID-19, government has developed a disease containment plan under which quarantine and isolation has been highlighted. Apart from this, trainings and availability of personal protective equipments for doctors and nurses are there. But due to the very low allocation of money for COVID 19, which is around 1.5% of the GDP and which is the lowest compared to other countries of the world, there has been a lack of personal protective equipment for doctors and nurses, and there is almost no PPE for other frontline workers like ambulance drivers, cleaners, etc. There has been a shortage of test kits, hence, the random tests in the hotspot areas were not yet done properly. The whole health system is grossly underfunded with variations in different states, which is the main challenge in India's disease containment strategy. Over the past weeks, there has been several reported cases of patients trying to flee isolation wards of government hospitals. And people are hiding their travel history out of fear of stigmatization. Hence, people are not coming forward themselves for treatment. There are different reactions among people. People who have enough resources are panic buying food items, especially due to fear of shortage. People without resources are facing starvation. Hence, many people are violating the lockdown and are on the streets. At this time, both public and private health sectors are playing important roles. According to a study conducted by the Center for Disease Dynamics, Economics and Policy, there are around 1.9 million beds, 98,000 ICU beds, and 48,000 ventilators available for COVID 19 patients in India at present. The study report further states that the existing bed capacity is mostly saturated in government hospitals and that the accommodation of influx of COVID 19 patients will require immediate expansion of the current capacity or modification in admission policy for routine patient care. The medicine available at present here is hydroxychloroquine. India's allocation in health system is very less compared to advanced economies, and out of the total allocation only 6.8% is spent regarding preventive care. Hence, apart from the present situation of COVID-19 infection, there are other diseases prevalent here like pneumonia, diarrhea, respiratory infection, encephalitis, hepatitis, and typhoid. At present, like others, I am also concerned about the economic breakdown that the country is going through, which will affect mostly the marginalized communities. So, what FADB is doing to support these marginalized communities is to sustain their lives by providing the essential commodities like food items and hygiene materials. Apart from this, FADB is also providing mental health support to children and adults and in 600 hospitals around the world. And I am hopeful that we will be able to fight COVID 19 infection and will be back to normal soon. Thank you.